That would change the healthcare landscape in Connecticut is on its way to the governor's desk tonight. It would allow for the first time nurse practitioners to practice on their own, independently of doctors. Our chief political correspondent Mark Davis is here live now with more. Mark?
Hi, Darren. Good evening, everyone from the Hartford newsroom. Yeah, this comes at a time when the state is facing a real shortage of primary care physicians. The bill given final approval today in the House will allow nurse practitioners to treat patients and prescribe medications without having a collaborative agreement with a physician. Several states have already done this in the name of making primary health care available to more people. Representative Peggy Sayers has been an RN for more than 50 years.
We have over 200,000 people that have signed up for the Affordable Care Act, and so there is a very great need to have primary practitioners in the state of Connecticut.
Representative Teresa Conroy has been a nurse practitioner for 11 years and has been trying to get this bill passed for the past 2 years.
Right now we know we don't have a lot of primary care physicians. Nurse practitioners have been trained for this. They go through a master's degree program. They take board certification in their specialties.
But the Connecticut State Medical Society, while not opposed to the idea, says there are problems with the proposal.
Requirements about extent of education, their ability to be trained in one area and practice in another area.
The new law would still require nurse practitioners to have a collaborative agreement with a physician, but only during their first 3 years of work. Then they could go out on their own.
If you collaborate with a physician who's a dermatologist or an orthopedic surgeon, should you be practicing in psychiatry, there are no protections in the bill as it stands to protect against that.
Now, despite that criticism from the physician community, Governor Malloy is applauding the passage of this bill tonight, gives every indication that he will sign it. As a matter of fact, he has been advocating for it. And he says it will help to expand the availability of health care to many, many more Connecticut residents. Live from the Hartford newsroom, Mark Davis, News 8.